Thank you, young boy, for your nice presentation. Yes, elaborately narrated various aspects of our health system in urban areas and almost in all other countries, where the bottlenecks of which step if we proceed, that bottlenecks will be removed. And overall, he has mentioned very nicely that it is a system where it will be available, where people will have to access through that service. Community available will participate, and that will be very affordable. Country and community will be able to afford the cost. Thank you, young boy. Now, may I please request Bali Zhang to present her presentation. She is serving in China Population and Development Research Center, China. The title of her presentation is The Analysis of the Departments of Community Health Services Utilization for Female Migrants and Their Children in China. Probably it's a new subject. Let's join her presentation. Thank you.
Good afternoon. Thank you for the chairman and the audience. This table is a little higher for me. I wish if you couldn't see me, but you can hear me. Okay. I wish I can provide a picture for the China reality. You know, we have a huge population, but the migrants in our country is very huge. And according to the national statistics, in 2011, we have 230 million migrants. So it's very huge, and we conduct this survey to understand their situation and try to find a better way to providing more good service for the migrants. Okay, let me start. We want to understand their awareness level about community health, and then we want to know do they use, and we also want to know what's the factors affect them to use the community services.
Dear participants, I'll be requesting you to come a little forward so that this is quite a large room for a seminar. But still, if you come just forward and excuse yourselves, we can start these plenary sessions. This is plenary session 2 on change in disease profile. The activity area 2 is change in disease profile. And this plenary session is on communicable and non-communicable diseases. We'll be very proud that our national professor, Brigadier Abdul Malik, will chair the sessions. He is also the founder of the National Heart Foundations. And the session will be co-chaired by Professor A.K. Azad Khan, President Bangladesh Ayurvedic Committee, Bangladesh, and will be moderated by Professor Dawan. Let me take the opportunity to moderate it. So I'll be requesting National Professor Brigadier Abdul Malik to start.
Professor Azad Khan, respected speakers, audience, participants, ladies and gentlemen, Assalamu alaikum. I'd like to thank the organizer for inviting me to join the session. And this is a very important session communicable and non-communicable disease. So we have got four distinguished speakers from different parts of the world, and time I think we are already late. I request them to speak on the subject, and to time I think so I hope moderator will contact. So so I request Mr. Kelly Adams to speak on NCD and post 2015 global agenda, how far we have reached, what more to be achieved.
Good afternoon, everyone. For those of you who saw me at 9:30 after arriving at 6:30, according to my business flow, I can assure you with 2 cups of coffee I'm feeling a lot better. So the next 15 minutes, I'm hoping to cover the issue of NCDs and pass over to my esteemed colleagues to talk about HIV/AIDS within the context of the post-2015 agenda, or as we used to call it, the replacement of the MDGs, but we're not allowed to say that anymore. Let me talk about the NCD Alliance. You're pretty aware from the pamphlet you have that I am the CEO of the Union of International Cancer Control, but I also have the privilege of chairing a movement of organisations that was created some 5 years ago, which are pulled together to represent the non-communicable diseases. And I must admit, we do not enjoy being a non-anything, but we are a non-communicable disease. And it started off with 4 organisations: World Heart Federation, International Diabetes, my own organisation for cancer, and the International Union Against Tuberculosis and Lung Disease. And for 4 years we continued with 4 federations, enjoying the support of over 2,000 organisations around the world in 170 countries. But I'm pleased to say that we are changing and developing. We are now welcoming Alzheimer's Disease International as part of the NCD Alliance, and within the next 2 months we'll be announcing 2 other organisations that will be joining us to cover one of the major risk factors for NCDs, and also a systems health specialist organisation to help us implement in country. Now during that time, 28 regional and national NCD alliances have emerged. This is an interesting organisational dilemma, because we did not encourage these country NCD alliances to emerge, but they have. And they have established the same model we have at the Global Centre in Geneva, in that they are working across disease silos in a horizontal or a way in which, diagonal way in which they can address the common areas that affect all NCDs, notably the risk factors, health systems improvements, and things like palliative care. It is a small team that actually runs the NCD Alliance, and I as a chair get involved on a daily basis. But together we are transforming the fight against NCDs globally. That's our ambition. Now let me talk about the current MDGs, and I must admit this has been one of the most interesting days I've had on all of my visits to see the MDGs mentioned so many times, and the impact they've had in Bangladesh and other countries. And I applaud you for the way you address the issues of the MDGs. But of course you'll be aware that despite the fact there are a number of them which are health related, there was nothing in there about non-communicable diseases, nothing about cancer or diabetes. There was a catch-all statement about other diseases, but NCDs were missing. However, NCDs are a priority for most organisations. It's gone past that myth that it was just a set of diseases for the developed countries. It is indeed in every country around the world, and particularly acute in some countries. The local statistics here for Bangladesh says that 52% of all deaths in 2010 were due to NCDs, and many of them premature. Because NCDs is relatively unknown in the development community, like AusAid, NORAID, DFID, etc., you find if you look at the total amount of spend which is made available to low-income countries to address NDGs, that actually less than 3% of it covers the NCDs. Now this is something we believe needs to be addressed in the future, but I must stress we do not see it as a replacement issue. We do see it as we have to address all health issues in a country and get the right balance. And there are some people in my group who would say that it's one of the Paris Declaration has aid effectiveness, and it's not meeting the direct needs of those who need to receive aid for the problems they face in their country. We really do believe that NCDs should be part of the post-2015 agenda, and I'll cover that a bit later, how we see that happening. NCDs, we believe, impacts all elements of development. It affects economic growth, social equity, and environmental protection is also linked to NCDs. The document you can see on this page actually is here. I have a few with me if you want them, but they are available on our website on ncdalliance.org. We make the case that NCDs do inhibit economic growth because of the healthcare cost implications, the loss of household income, and the debilitating way in which it affects the growth of the nation economically. We also believe that it contributes to poor social equity, and a lot of the environmental issues which are drawn from urbanisation, transportation, air pollution are also contributors to risk factors for NCDs. So NCDs is right in the heart of the sustainable development agenda. Now this looks like a very complicated slide, and it is. My apologies, but when I was asked where are we in terms of the process of the post-2015 agenda, I thought it'd be worth just putting up a slide like this so you can follow it. These slides, I believe, will be made available. Let me just go through the top bit and make it simple for you. So we run from 2012, 13, 14 and 15. 2013, in the process of finding the replacements, the MDG, and the emergence of sustainable development post-2015, there was a lot of content generation. An open working group has been created. We also had a high-level panel created, which had my Prime Minister David Cameron on it. There's been a lot of consultations through experts and also member states. And we've had the Secretary General report, which came out in September 2013. The second red line on that sheet shows you exactly where we are today. So the open working groups are reporting. We should have a report forward in September, although early iterations of that will come through. Then we'll have a synthesis report coming from the Secretary General, which will go into the General Assembly in New York in September. And then we'll go through to a period of member state negotiations about what the content of post-2015 sustainable development goals will be. Now, NCDs obviously are important to me. Others believe in other health issues should be in that space. And of course, it doesn't just include health. There are a whole series of things that want to be included in there. And there's an awful lot of lobbying which is taking place in New York at the moment to make sure that every aspect of global development is included in that process. I think that we'll probably get close to a conclusion, or rough conclusion of where it's going to be by the middle of next year, but we're still some way off. There are lots of negotiations running in parallel, some of them behind closed doors, and some of them are formal. This has been the process so far. So in June 2012, there was the Rio Plus 20 Conference on Sustainable Development. Then we had the high-level panel of eminent persons established in 12 and 13. We've had a global thematic consultation through a website called The World We Want, and as NGOs, we're all able to put in our comments and our perspectives on what should be included in the post-2015. And as I mentioned, we've had these open working groups. I think we're up to open working group number 8 now, talking about various elements or things that should be included in the agenda. The role of the NCD Alliance, working with its membership around the world, has been to make sure that NCDs have appeared in all those discussions. And we produced several documents to position NCDs in the context of some of those themes. Where have we got to? Well, in Rio Plus 20, there was an acknowledgement that sustainable development can only be achieved in the absence of a high prevalence of debilitating communicable and non-communicable diseases. And I'll refer to that later when I present the NCD Alliance position on what we think should go into the document. At the thematic consultation on health, it said NCDs was recognised as a priority for health in post-2015, placing emphasis on health promotion, behaviour change and disease prevention. And there was also some things in there about tobacco control, which was good to see because it's a major risk factor for all NCDs, if not more. The UN high-level report said that it proposed a health goal of ensuring healthy lives and a target to reduce the burden of NCDs, which is good to see in that report because it's then fed into the following discussions and negotiations. And the Life and Dignity for All report from the UN Secretary General in August 2013 recognised that sustainable development as a global guiding principle for the post-2015 era and recognises reducing the burden of NCDs as a priority for health and development in post-2015. Now, I must admit, we've gone through this process. There's been occasion when we didn't feel that health was going to feature in the post-2015 agenda. But over the last few months, it's become clear, after September last year, when we had the review of the MDGs at the UN in New York, that health is emerging as a major issue. What we are attempting to do is make sure that health is not siloed as a single target or single objective, that health actually is built into the whole of the Sustainable Development Agenda. This blue thing, which you see on the screen, is a house. It's a house built by the NCD Alliance, working with experts around the world. And I would like to go through, because this is how we think health and NCD should be positioned in the post-2015 agenda. We believe that there should be a universal, rights-based, equitable approach. We believe that the health goal that measures outcomes and accommodates all priorities, including NCDs. The health goal we actually put in there is maximising healthy lives at all stages of life. And please note at that point we don't mention NCDs. We believe that that is a goal which has got general support around the world for all elements that are supportive of health being in the post-2015 agenda. For many of us who have been involved in NCDs over the last few years, it was significant that we were able to secure a UN commitment to a reduction of 25% of premature deaths for NCDs by 2025 at the World Health Assembly last year. And we believe that sort of target, given it's been negotiated by all member states, should be included somewhere in the post-2015 agenda. Unlike others, we believe that universal health coverage and access is a key enabler to deliver a standalone goal of maximising health livelihoods at all stages of life. There are some organisations and individuals that are pressing the universal health coverage to be the only target for the health elements of post-2015. I think we are now in a position where they've accepted that's not sufficient. What we do insist on, though, and we do campaign for, is to make sure the health-sensitive indicators are across all the dimensions of whatever framework emerges through this period of consultation. So this is where we are today on the open working group. Phase 1 stock taking has been complete. We're now going into decision making. That will go from March 2014 to July. And then the presentation of the report with the proposed framework in draft will be presented sometime between July and the General Assembly in September. What is the current view on health that we're seeing both at the UN, talking to the missions, talking to those individuals involved in this process? This is what we're hearing. Health and population dynamics are going to be a sustainable development goal focus area. There is a convergence around a standalone goal for health and links across the SDG framework, which is what I just said is something that we've been pushing for. It will include health-related MDG priorities, NCDs, prevention and treatment, neglected tropical diseases, SRHR, access to health services and health system strengthening. That is a consensus that we're beginning to see. It will address healthy lifestyles, including adequate nutrition. It will focus on the poorest and most vulnerable, and they will also consider the environmental determinants of health. The OWG co-chair, in their transition notice on the next stage, wrote, "Improving healthy life expectancy is a widely shared endeavour." We take that as a positive that there has become a general support to put a health life expectancy target in the new framework. However, there are still some questions outstanding. What will be that health goal and how will it be formulated, and what role will civil society and others have in discussing the nature of that health goal? Will it be integrated across the SDGs, or we end up with just one goal on health and not across the other targets or the other elements of the SDGs? What will be the overall balance of the framework? Will it be heavily skewed towards some areas of development which probably we don't believe are appropriate? We would certainly like to see a balance towards health, which we believe affects all elements of a healthy environment and healthy economy. And what targets and indicators will be included? This will be subject to all the negotiations which will take place in the next 6 to 9 months. However, there's lots of other meetings taking place which will have an impact on those sustainable development goals, and I've just got 2 of you now. One is the International Conference on Nutrition 2014, which will take place and consider the impact of nutrition from a security perspective. Predominantly from a nutrition for the poor, but of course, we wish to include that about obesity and also the transfer of foods around the world. So the NCD Alliance and the World Cancer Research Fund have done a joint paper on this, which we download on our website, which says that we would like to leverage that to make sure that there are connections are made between nutrition and NCDs, calling for NCDs to be addressed as a global nutrition policy issue. Then we have the World Health Organization, which is working with the World Bank at the moment on the universal health coverage. And again, we are promoting inclusion of NCDs in UHC, and reinforcing UHC to be an enabler for post-2015 and not being a target in itself. And we're actually working with a whole range of organisations across the health field. We created a group of organisations in New York which covers maternal health, child health, HIV/AIDS, TB, and all the NCDs. And there's a consensus forming around that. The key messages for us on the NCDs and post-2015 are included in this document, and I'm not going to read it out, it'll take an hour. But let me just summarise what it says. The human and economic costs of NCDs are undermining development gains made to date. NCDs are linked to all three pillars of sustainable development: economic growth, social equity, and environmental sustainability. Post-2015 development agenda demands an overarching health goal that captures healthy life expectancy. NCD prevention and control must be included as a target in post-2015, adapted to the 25 by 25 mortality target agreed by Member States at the World Health Summit last year. And a key enabler for improving global health in post-2015 will be tackling the underlying social determinants of health. Now, I'd like to finish just by reading out one line from this document because I think it's quite important. There has on occasion in the past been a concern that the NCD movement wishes to replace the communicable disease issue within the financial funding, ocean development systems, and also the NGGs, and that's hardly true. We actually perceive there's a lot of synergies, there's a lot of building on current infrastructure, and we have plenty of projects running around the world, and I've heard some today, where we can combine the issue of dealing with cancer and dealing with HIV/AIDS. So let me just quote one line in here, which I think is important, right hand over to our next speaker. Collectively, we must ensure that health remains at the heart of the future development agenda, with a framework that accelerates progress towards achieving the current MDGs. We believe on the NCD Alliance that we still have a lot to do to deliver those MDGs, while fully addressing the new health priorities, most notably non-communicable diseases. And in that way, we will realise the mission for a healthy future for all. Thank you.
We have already launched you. I have the privilege to call the next speaker is Leo Kennedy.
And I know that you'll be devastated to know that I'm not going to use a PowerPoint in the interest of time. I do feel, however, that I really am taking up from where Eric left off. And as the UNAIDS country director, I probably shouldn't say it too loud, but I very much agree with you that NCDs, and particularly with respect to Bangladesh, is where we are going to have to put our efforts. The question is, where will it be situated in the SDRs? And what about the unfinished business of the MDGs? So I just wanted to talk a little bit about the aid response here to illustrate some of that. But I do want to, I think you were also in the last session where we were talking about community health and the incredibly important role that that will play in, not just in the delivery of services, but in addressing some of the fundamental principles. And this is where I think we are not seeing enough discussion in the working groups, the high-level panel. In fact, in Bangladesh, we're told that we're going to be moving to the how from the what, where we haven't defined the what of post-2015. So that's a worry. But where I agree with you, Carrie, is that NCDs are probably going to make infectious diseases pale in insignificance. I may exclude from that extra drug-resistant TB, but certainly diabetes, heart disease, etc. It's going to make us think differently about the way we deliver services and why we deliver services. But in the end, I think we have to come back to fundamental principles. And as I say, I do not feel as if the discussion is paying enough attention to that. There will not be a goal on HIV like the MDGs. You can be assured of that. And as Barry says, we're probably looking at something more akin to universal access. As the largest LDC in the world is being heard loud and clear. I think the process and consultations around the post-2015 agenda are a credit to government and to civil society. It's been inclusive, and I think it embodies many of the principles that need to be considered in the post-2015 agenda. Gender equality, human rights, inclusiveness, and I just think that these are things which are critical. In a couple of months' time, ICPD, the International Conference on Population and Development, is an opportunity to make those sorts of issues resonate, particularly around the issues of sexual and reproductive health rights. These are going to have to be looked at very carefully in the unfinished business. And I think that the ICPD preparations are well underway in this country. We need to look at how we can take those forward and make sure that civil society is an integral part of that, and that inclusiveness is an inalienable underlying theme. Let me give you some examples of, I think, where we can look at HIV being situated within the universal access to health, or I know that there's various discussions around what we're talking about, but we are talking about all people having access to decent health based on human rights. At the moment, Bangladesh is considering, for example, and developing a national social protection strategy. To me, I think this is where AIDS is going to be situated. You might even find that UNAIDS becomes UN National Social Protection or something like that. What do I mean by that? Well, national social protection in Bangladesh includes things like health insurance. You may find Bangladesh provides health insurance to the poorest quintile, and there are plans to do that now for the poorest 42 million quintile. You'll find that they're doing that before the United States of America. So I think that national social protection needs to build on the lessons that we've learned in the AIDS response, those principles that I've just outlined to you, the principles of inclusiveness, human rights, gender equality. We're going to have to make sure that the social safety nets under national social protection strategies are in fact making sure that they're reaching the people who are most vulnerable. They include those people who are most vulnerable to HIV infection. They include the key populations that we need to do a lot more work with in Bangladesh as unfinished business of the MDGs. I'm thinking particularly of people who inject drugs, of sex workers, male and female, transgender, intra, and I think that we've made quite a lot of progress with regard to entrenching and enshrining their human rights in any of our discussions about equity and access to universal health in the post-2015 agenda. So I do feel that there is really still much more room and scope for the voice of less developed countries. I think groups who are pushing agendas on non-communicable diseases and infectious diseases, we need to basically have a lot more discussion around those areas. When we talk about the AIDS response in Bangladesh, You know, clearly there are still large groups of issues that need to be addressed now and post-2015. One of the most important ones in Bangladesh is that we are not detecting enough cases to make a significant impact towards the 2015 goal of zero new infections, zero age-related deaths, and zero stigma and discrimination. We just came from a session on community health a minute ago where we underlined that stigma and discrimination are in fact the driving and the impediments to achieving zero new infections and zero age-related deaths. In Bangladesh, we are currently detecting about 1/3 of the estimated HIV cases, and I think our estimates really need to be looked at. So there's a lot of work to be done there before we can start implementing a new treatment 215 strategy, which asks us to take the treatment, beginning of treatment from a CD4 count of 350 to 500. What that means for Bangladesh is that we would probably have to double the number of people on treatment in this country. But the upshot is that you can't treat